Welkom bij Ouderverstoting Overwinnen. Vandaag gaan we kijken naar een filmpje van Dr. Craig Childress. Zijn onderzoek, zijn research wordt gebruikt, massaal gebruikt, om te zien hoe zit het nou met ouderverstoting. Hoe moet je ermee omgaan? Dit ligt ook bij de Raad van de Kinderbescherming, dus ze zijn bekend met zijn werk. In deze aflevering praat hij erover waarom het fout gaat bij therapeuten, waarom ze het niet herkennen en wat je moet doen om te zorgen dat ze het juist wel gaan herkennen.
Hello again, I'm Craig Childress, clinical psychologist in Pasadena, California. And in this video segment, I'm going to be discussing a particular process, parent-child relationship difficulty that I refer to as parental alienation dynamic. And in this particular video segment, I'm going to be discussing how we go about training child psychotherapists so that you, as a targeted parent, can understand where some of the problems begin to emerge as you try to work with the mental health field. Now, I've trained a number of child therapists. I was a clinical director of an early childhood assessment and treatment center and was supervisor and did the clinical training for a number of master's level and doctoral level students in child psychotherapy. I also worked as on medical staff at Children's Hospital of Orange County, where I worked in their APA internship program, working with predoctoral interns, postdoctoral fellows, and supervising their work and training them. I've also taught graduate level courses in diagnosis and psychopathology, as well as graduate level courses in child psychotherapy. And so I've trained a number of child and family therapists. And there are particular ways that we go about training them that are problematic when we deal with the parental alienation dynamic. First off, we don't train therapists to be child therapists. We train them to be adult therapists. This is because as therapists begin to enter the field, they don't know what they're doing. And so we have to train them in the very basics of psychotherapy. And psychotherapy is based, starting with Freud, in what was called the talking cure, that we have to communicate with our clients. And so we begin by training them in adult psychotherapy models that allow them to develop some of the therapeutic skills while they discuss the issues with their adult patients. That it's because children are nonverbal and because child development involves the maturation of various brain systems, it's more complex to do child therapy than it is to do adult therapy. So we start with the simplest. We start with adult psychotherapy. In addition, because these early child psychotherapy or early trainees don't understand what they're doing, it's really important that we train them in the approaches where they don't hurt the client. Okay? So while they are learning, we train them in very low-risk types of interventions. The basic low-risk intervention comes out of the humanistic existential school. It's called client-directed therapy. Its main theorist is Carl Rogers. And what Rogers proposed is that if clients are given a set of relationship contexts, then they will sort of naturally grow and self-actualize. Rogers referred to the necessary context as being empathy, unconditional positive regard, and genuineness. And if we give our clients that relationship context, empathy, unconditional positive regard, and genuineness, they will just naturally tend to self-actualize in that environment. And actually, as we look at some of the neurodevelopmental stuff coming out of early childhood, there's a lot to be said for that. It's actually, there's some support for that coming out of brain research. But I'll get into that in a different place, different time and place. But this is referred to as client-directed, that the therapist really doesn't intervene very strongly or advocate for a different position or give advice or take much direct action. They rely and follow the client in their own sort of self-growth. And so this is the first model that we teach therapists as we begin to help them develop the therapeutic skills necessary for working with clients. Then once we get past to the client-centered model, we then typically add on the cognitive behavioral model for adults, because the cognitive behavioral model is pretty structured. It gives specific guidelines for what to do in specific situations. And so it limits the amount of variability that the therapist really has. So if the client is doing this, then you propose that. It's very manualized, and so it limits the risk that the early therapist will make a mistake or do something wrong. Now, in terms of behavioral psychology, I was trained as a behavioral psychologist. That was a model I worked from for a number of years. But since moving to early childhood and understanding sort of the child development and the neurodevelopment of the brain in childhood, I've come to understand that the behaviorist model is problematic in working with children. And I suppose if you want to work with adults on it, that's fine. But for working with children, there are particular problematic issues related to it. But I'm not going to get into that necessarily here. Now, in training therapists, that's typically where we stop because we run out of time. By the time we get through client-centered therapy and behavioral therapy, we're kind of reaching the end of their education training or graduate level education training. They may get some additional theoretical training in psychoanalytic school or humanistic existential or family systems approaches, but this is sort of an add-on type of thing. Typically, the trainee needs to seek out these additional training experiences. And then once we train the therapist to be an adult psychotherapist, then some therapists will seek out additional training in child psychotherapy. Now, when they do that, there's typically two different schools of child psychotherapy. One is play therapy, primarily derived from the psychoanalytic school / humanistic existential school. There's two different variants of that. The other is behavioral therapy out of the cognitive behavioral school. But because children's thinking isn't fully elaborated and developed, we don't really deal with children's cognitions as much as with their behavior. And so it's primarily behavior therapy for children. And I'll discuss those child psychotherapies in the next video segment.
Heel boeiend dit. Waar hij het dus over heeft is dat psychotherapeuten in opleiding, die krijgen eerst de simpelere modellen, zodat ze geen schade aanrichten bij hun cliënten, patiënten. Dus eerst voor volwassenen en op een manier waarbij ze eigenlijk die persoon volgen. Dus de cliënt volgen.
What they're doing.
Dus helemaal niet met kinderen. En later pas, na de opleiding, krijgen ze dus les, training in hoe ze met kinderen om moeten gaan. Maar dan ook nog geeft hij aan, de therapieën sluiten niet allemaal aan. Kijk, als kind heb je nog geen vergroeide frontale kwab. Pas als je 25 bent, ben je helemaal volwassen. Dus dat geeft ook problemen. Ga nu eens na hoe dat zit in de jeugdhulpverlening. Al die hulpverleners hebben 0 training in psychotherapie. Dus dan is het logisch dat zij heel veel niet herkennen. Dus dat is helemaal niet raar. Dus dat is wel een eye-opener hier. Van hoe ga je daarmee om? Hoe ga je dit in de praktijk oplossen? Want in feite heb je psychotherapeuten nodig die op de hoogte zijn van hoe moet je omgaan met kinderen. En dat is een veel hoger niveau dan de normale jeugdhulpverlening. Dus wat je hier ziet, is eigenlijk logisch dat het vaak niet herkend wordt in de praktijk. Dankjewel voor het kijken. Like, subscribe, stuur een e-mail. Laat me weten wat je wil zien. Laat me weten wat je hiervan vond. En tot de volgende uitzending.